Good morning, everyone. My name is Gerry Barrett, and I was invited by ICPO to share with you today briefly my experiences as a patient perspective of weight management and digital technology. So please bear with me for the next 5 minutes or so. I'm 60 years old and I've been battling obesity from since late 20s. Like most people with obesity, my dieting has been like a yo-yo, with various diets over those years. Between 2002 and 2007, I lost 10 stone, but then after returning to work from a year off traveling, I put all the weight on over the next 3 years. I've been a maintenance technician since the late 70s. I've sat at a desk using technology to make changes and fault finding on phone systems across Europe. I've spent my life fixing things that were broken, but sad to say I had difficulty in fixing myself. So when did I really get serious about losing my weight? Well, it was after I developed diabetes, and despite medication, my sugar levels continued to rise. This introduced me to my first connection with digital technology from a weight management aspect. I had to test my bloods on a daily basis, which I then connected to my computer and downloaded my information. This information was then gathered together and ended up as a printed sheet that I could take to my GP to discuss. This app tracked my sugar levels, and it indicated to me that my sugar levels were increasing on a monthly basis. I don't know that without digital technology, I would have kept records that I had easily at hand to download. I discussed with my GP, and my options were to increase the medication or take my obesity seriously. Well, I tried for the second option. My eating habits ranged from rushing my breakfast before my 2-hour journey to work. Throughout the day, I wouldn't eat, and when I arrived home, I would devour my dinner late at night, followed by various snacks while watching TV. I found a very highly developed nutritional product which supplied me with the nutrients my body needed to sustain me throughout the day. I could take this while driving to work and during the day easily, which worked out well for me. In the evening, I ate a standard dinner of protein, carbs, and fiber, and some low-calorie protein snacks if needed. As a result, I lost in excess of 4 stone. I attended Loughlinstown Weight Management Clinic for approximately 6 years, and there I received guidance in nutrition, exercise, medical advice, and above all, time with a psychologist, all of which were excellent. I had trouble deciding initially if surgery was for me. It was not a decision most patients make easily. After being notified in July 19 that I was approved, I accepted without hesitation. December 2019, I had a sleeve gastrectomy carried out in St. Vincent's Hospital, Dublin by Professor Helen Hennihan and her team with the weight management team in Loughlinstown. So where does digital technology come into it? Well, I became heavily dependent on Facebook. I communicated with the private weight management service Facebook page support group on a daily basis. I received friendly advice and an empathetic ear. They are an incredible group of people, and dieting is something we hear mostly women discuss compared to men. That doesn't apply in this group. It's a place like no other where I am amongst people who understand. Due to the pandemic, I've had no follow-up appointments since January 2020, thankfully not needed. I do, however, join when I can the weekly virtual meetings run by the Irish Coalition of People Living with Obesity, the ICPO, on the GoToMeeting platform. These comprise of our Facebook group members, other support groups dealing with obesity, and on a regular basis by healthcare professionals from various weight management services. This keeps us updated and the opportunity to have a question and answer session. These meetings are a step up from the written words on Facebook page, and the instant connection with the group has been a game changer for me and for others. Support is key, and whether you log on and listen or log on and share, it connects you to people who understand your thoughts and feelings. Other avenues within digital technology I've used are the Tracker app, which logs my daily steps. I enjoy reporting back to the Facebook group, where we are encouraged 5 days a week by Francis to share our steps with each other, regardless if they are 20 or 20,000. I use WhatsApp groups with many overseas calls to my family and friends, which keeps me happy and mentally well. I've used the Instagram platform to keep me updated on what's happening in the areas of weight management. I haven't downloaded TikTok yet, but have enjoyed some of the posts during the lockdowns. All these platforms enable us to connect, to hear, to see, to laugh, and indeed to cry. But more importantly, we will never again to be alone. I would encourage people to use the digital tools we have at our fingertips to help us to keep safe, healthy, motivated, and above all, connected. I had not given thought before this presentation on how digital technology plays a part in my health and weight management, and many others don't either, but should be encouraged when it clearly has a positive effect. What I have learned sharing this presentation today is that digital technology does not play a temporary role in my weight management, but a long-term continuing role. I would have preferred that I could answer any questions you may have, but I'm unable to do so due to work commitments. My email address and contact number is available if anybody wishes to contact me. Many thanks to Susie and Julia for giving me this opportunity to speak to you briefly here today. Stay safe and keep well. Thank you.